They don't want people to be able to just get them whenever they want because you run into this IgG4 problem when people get tons and tons of RNA together. But ultimately, it just means this product isn't good enough. We shouldn't sacrifice protection to bring a product to market because the protection we need isn't possible because it creates an unfavorable response. We shouldn't cut our protection back to use the product that creates the unfavorable response in order to avoid the unfavorable response. We should use a product that doesn't have the unfavorable response, that offers complete protection. This idea that we're sacrificing protection to keep a product on the market with a known issue doesn't make any sense. It just doesn't make any sense. It makes sense from a business standpoint, but it doesn't make sense from a public health standpoint. And in the past, before we had such bad regulatory capture, it was very normal for us to approach that way. But now the regulatory capture, which is very much in line with a decision made in Congress. Maybe I'm going to mix this up because I just learned about this. But basically, they changed the rule. It's basically Citizens United for the FDA. So instead of the FDA being funded by the government, they instead get money from the people who are doing approvals. And so if Pfizer is the company doing the most approvals because they have the most drugs, then they're essentially footing the bill to keep the FDA's door open, which gives them an insane amount of power. And that's pretty much the problem we're dealing with. So we basically have a Citizens United, but for the FDA problem. And we really have to go back and re-regulate that issue. Bad news, it exists. Good news, we actually know what needs to change. Because the government is self-funds the FDA and takes away that burden, then there's no reason to placate, pharma companies in order to pay the bills. So that's where we are. You can't have the arsonist paying to keep the fire department going.